Good afternoon. My name is Corina Herrera Loera, a Public Information Officer with the Emergency Operations Center here in Santa Clara County. As you see, we have Dr. Gerardo Solorio Cortez here joining us to answer any questions and also give us an update. But before we turn it over to our doctor here today, I'm going to give our usual briefing that we do every other Wednesday. And so, bear with me. Whoop. Okay. So the update that we have today, as most of you know, a lot of it, might be a refresher. Some of it might be new information for you. If you're keeping up with our numbers and our dashboards, you will see that in our county, unfortunately, our numbers are raising, and I'll go over that in a little bit. But due to the numbers going up and the variant, some of you have heard of the Delta variant, which is COVID. And it's one of the variants that is going around. And so due to the COVID cases rising locally and increased circulation of the highly transmissible Delta variant, we recommend the following: to wear masks indoors, regardless of vaccination status. So as most of you remember, it's different from the announcement that came out in May. We are recommending that we all wear our masks regardless of vaccinations when indoors. Santa Clara County recommendations to businesses is to adopt a universal masking requirement for customers entering indoor areas and encourage fully vaccinated employees to wear masks indoors if their employer has not confirmed the vaccination status of those around them. So that is the current recommendations. Just highlighting, it is a recommendation at this time. We are doing our best that it remains a recommendation so that we don't have to go back to any mandates like we had before. And so with that, our COVID-19 daily update for as of yesterday, those are the most recent numbers. In 83.1% of 12 and older with at least one vaccine dose in our county. So those are 12 and older in our county. We have 83.1% that have had at least one vaccine dose. And we have 76.9% of the 12 and older who have completed the vaccination. So whether it's the second dose or they've received the one that they're completed. And so the number of COVID-19 as of yesterday, and it's a 7-day rolling average, is 102 new cases. In regards to our Hispanic Latino community, as mentioned previously, those of you that tune in, we are unfortunately at 62%. So even though the entire county, looking at the entire residents, the number is higher, as I mentioned earlier, the Hispanic Latino community continues to be a lower rate. So the 62%, and unfortunately continue to be the higher cases of COVID-19. And so again, encouraging everyone to get vaccinated, but especially those communities that are highest impacted. If you haven't gotten it yet, remember to go. You can keep updated on the dashboard and the addresses there if you're interested in looking up those numbers. So this is the update as of July 19th. We had 62% of our Hispanic Latino community vaccinated. And just a reminder that all individuals ages 12 and older are currently eligible for the vaccine here in Santa Clara County. And as the others become eligible, we'll make sure to get that out. But as of now, those ages 12 and older are currently eligible for the vaccine. And so if your child is ages 12 and over, we encourage you to get their vaccine, especially those of us parents, know that the school's coming back. We have approximately 3 to 4 weeks or so before our children go back to school. So encouraging our parents to ensure that our children have the vaccine. And if you are able to go this week or next week, that you're able to get both vaccines and be vaccinated completely before school starts. And if you do go to any of our county sites, this past week, actually, just a little while ago, the winners were pulled, and that was for the Alejandro Fernandez, Justin Bieber, Enrique Iglesias, Ricky Martin, or Banda MS. That was the raffle we had this past week. So the winners were picked today. Tune into our Instagram and find out if you won. For this upcoming week, we have the Bad Bunny and the Weekend included, and more. So if you haven't gotten it, you are able, if you get your vaccine, you're able to get a ticket, and then whoever took you, they're able to also get a ticket and put their ticket into the raffle. So good luck to you all. And these are vaccination sites that we have for this week, the week of July 19th through the 24th. As you can see, we have Overfelt High School, Alpha Blanca Alvarado Middle School, Del Monte Soccer Park. And just to highlight on the Del Monte Soccer Park, which happened yesterday, but typically every week we do our best to have a night clinic. So if your work schedule allows better for a night clinic, stay tuned. We are having those what seems to be weekly and maybe even bi-weekly. For those of you who a later time works best, and you can always call us on our vaccine number that I will show soon if you are interested more in the later times. Other than that, there are weekends available, and you're able to go to any one of these sites. And we've had many questions about replacing vaccination cards. Some of us have lost them in the process of getting the vaccine initially. So there are 4 different ways that you can replace your vaccination card. The first one is requesting it from the state. And so here you'll see the where you can go and request it from the state. myvaccinerecord.cdph.ca.gov. And you can do a search. So you can do it from the state. If you are vaccinated at a mass vaccination site or mobile vaccination site ran by our county, you can visit the expo hall at the county fairgrounds. So the entrance gate is gate D at the 2542 Monterey Road, San Jose, California 95111 location. So you can go there in person, or you can contact the healthcare provider that administered the vaccine. So if you had a private healthcare provider or any one of them, they can also provide it to you. Or the 4th way is requesting a COVID-19 vaccine record, no matter where you received the vaccine. So it could be either from a private, from the county, from the state. And you can do that in person at the Public Health Department Travel Immunization Clinic, and the address 976 Lenson Avenue, Suite 1100, San Jose, California 95126. The phone number to call there, and if you have any questions or need any additional information, is 408-792-5200. And so here, I always want to put up numbers. You might need them, you might not. You might know somebody that might need them. So just reminders, we have the support line, the COVID support line, the 408-808-7770. Know your rights in the workplace, 1-866-870-7725. Any mental health services. We know we all went through a lot this past year and a half. And so there's a phone number for our mental health services in our county, 1-800-704-0900. And also our crisis hotline, always good to have it. You never know if any of your family members might need it, any of your friends. And that's a hotline that's available 7 days, 24 hours a day, 1-855-278-4204. Or you can text RENEW to 741741. Again, the call center, easy number to remember, 211, readily available. And if you call there with any needs, they will then direct you to the right place. If you have any questions specifically about the vaccines, making appointments, sites, etc., you can call the 408-970-299 number. Or you can send a text message COVID-19 to 211-211, and then somebody can respond to you via text for any of your questions. Thank you so much. Now, I am happy to introduce you. Some of you who don't know, we have Dr. Gerardo Solorio Cortez here, who is located at one of our vaccine sites and has been there for several months now, maybe even a year or more. But he can tell you a little bit more about what he's doing and some of the updates, in particularly around the vaccine, and then help answer any questions that any of you may have today in relation to the vaccines, in relation to any of the updates that he's giving or that I have given. Stay tuned. Make sure you put your questions there. And I will then moderate after he gives us an update. I'll moderate a question and answer period with our doctor here today and myself. Welcome, Dr. Gerardo Solorio Cortez.
Hi, good afternoon, Corina. Thank you again. Thank you again for the invitation. Welcome everyone again. My name again is Dr. Gerardo Solorio Cortez. I am a primary care internal medicine doctor at Valley Health Center, Gilroy, and I'm also one of the leaders at the vaccination site. I think today, two big points that I want to make, and you presented all that data well, thank you, Corina, is the percentage of people vaccinated. And as a county, we're very proud that being one of the largest counties across the United States, we have the highest percentage of first dose vaccinators, and also people being fully vaccinated being at 70 to 82%. But as you mentioned, Corina, on your slides, there's populations and pockets, and specifically now I'm talking about the Hispanic, Latino, Latinx community in terms of the percentage being in the 60s. So my plea is for those that have not gone their vaccines or not vaccinated to please, all the information was given to you by Corina. Please get vaccinated as soon as possible. We need to get to that, again, comparing that number in the 60s, we need to get to the levels of what the average is, or the level is here in the 80s in the county. Again, the message is that these vaccines, all three of them, Moderna, Pfizer, Johnson & Johnson, are very effective and safe vaccines. So for anybody that's 12 years old and above, please get vaccinated. And then the second message that I wanted to make is, now as you've seen or heard in the news, is the Delta variant. And the current recommendations from local, state, national authorities, talking about the CDC, NIH, the FDA, at this point, being fully vaccinated with Moderna, Pfizer, or the one dose Johnson & Johnson vaccine, they're very effective to current variants, and furthermore, the Delta variant. To step back a little bit in terms of what does it mean to be a variant, I think it's important to just go back when all this started. COVID pandemic, and more specifically the SARS CoV-2 virus being the cause of this disease. So if you think about it, we had the original virus, and through time infecting individuals, this virus has been able to change. Previous viruses, you could change for the better, for the worse. In this case, what we know is that the Delta variant is more contagious, and it could be also more severe in terms of the disease course. So that's a little explanation on what the Delta variant means. Pretty much, it's a mutated form coming from the original form, but it's something that was expected, and in terms of, because that's what, in terms of how viruses and infections work. But luckily, the three vaccines that we have available now are very, very effective and safe against these variants. And I'll just keep it, us as well, we're keeping in the loop with the news. And if and when the CDC, FDA, NIH says that a booster will be needed, we will let you all know. Thank you, Karina.
Thank you so much. And as I mentioned earlier, please make sure to put your questions down. I have read a couple of the ones that we have already, so looking forward to answering some of those. So I'm just going to go down the list here. Let's see. We have Trisha Moeller who joined us. Welcome. Ofelia Medina. Thank you for keeping us informed, Corina. Thank you, Ofelia, for joining us. We have Dennis Bosas. Let's penalize people who doesn't take the vaccine. Thank you, Dennis, for your opinions. Christina Marie. So she has a question. The first question here: will schools open in September? And I know that's not really focused, specifically on the vaccine, but it is focused in regards to the COVID-19. And as a county, the answer is yes. Schools will open in September. I know that every district, they're all working very hard right now to ensure that the classrooms are safe enough for the children. And so in regards to each specific district, I'm sure everyone is doing, whether it's a hybrid mode, whether some children will be able to continue maybe going to school from home or in person. So I suggest that you contact your district directly to see, one, the dates, two, what the options are. If if you're interested in them continuing in distance learning and what those options are, I would suggest that you connect with your district specifically. So yes, schools will continue to be open in September. I think a lot of them start in August. So if you might be new to our area, know that a lot of our districts start in August, some in September. But yes, schools should be open in September. Thank you, Christina, for joining us. And then Christina's wondering about the data for mask for kids. In regards to specific data, obviously we don't have it readily available here. And I'd like to hear if you have any specific questions to hear more about the data. I'm happy to get that and provide that maybe in a future community forum. And in regards to the question if kids will need to wear the mask, my understanding is the mandate is that the kids will continue to be wearing their masks in school. I know that for our local school district, for the Alamark School District, that will continue to be. Our children will continue to wear a mask. That's where my daughter goes to school, and I participate, in that district, and I'm a part of that district. So I know there, yes. But again, contact your district directly if you have any particular questions around any of the safety precautions that they are doing in your child's district. Thank you, Christina, for joining us. And we have Paige Hooper here. I'm so glad I live here instead of my home state of AR. I want to say Arkansas, but I'm not sure.
Arkansas, yeah, Arkansas.
Their numbers are out of control. It's so sad. Good job, everyone. Thank you, Paige. We're all just doing our part, doing our best to keep everybody informed so that we continue to be safe.
Karina, I think it'll be a good or just piggyback off that comment, and the theme is that the data coming out is those that are in the hospital because of COVID or dying because of COVID right now at this moment is the unvaccinated. So 99% to 100% of those cases, for example, looking at Maryland put out some data a week ago where 139 of their deaths in June were all unvaccinated individuals. So it goes to show you that that these vaccines work, and if you're vaccinated, it prevents the hospitalization and death, definitely.
Thank you. And then we have Paul Horseshoe Soto, Rolando Bonilla spoke about opening up the Mexican Heritage Plaza again, and I thought that was an excellent idea. I would like to know what the county thinks about this idea, considering the vulnerability in Sal Si Puedes. Very good question, Paul. I know that it's something that I mean, I can't speak on behalf of the county or county board supervisors. I'm, just part of the EOC here. But in regards to the area and understanding the needs here, know that we are continuing to advocate, for um, vaccine sites. I know that that one particularly was ran by another agency, and so know that our leaders will continue to see one. I mean, it could be that I don't know the details. It could be that maybe the Mexican Heritage Plus is not available. Maybe it is, but as a leader, looking to see what the details are, and in the area that vaccines become available, so that our community has a easier way to get to these sites. And so my understanding is in the area, Overfelt continues to be a site that's available locally. And then I know that the Emmanuel Baptist Church on White, those are the closest. And I'm just saying those out loud in case you do live in the area and you were close to the Mexican Heritage Plaza. My understanding is that right now is not open. And if it's not, and obviously the need is a vaccine, that Overfelt is not too far from there, and then Emmanuel Church, depending on where you're at, might be closer to you. And there's several other locations, and we're also happy to answer any questions and or even provide transportation if that's a need. I know that we have some resources to be able to do that. So thank you, Paul, for joining us. Very good question. We have John Q here. John, first dose get 25 gift card, and the second dose gets $30 gift card. Maybe a lot of people in line wait for vaccine. Try it. Good idea, John. That's a great idea. I'll bring it up to the team. Definitely, gift cards to different places might be a way of getting people there. I agree. Especially if people have to wait in line. So thank you, John. I'll make sure to bring that up to the team. Tamara Mosawani Alvarado, great to get an update. Thank you, Tamara, for joining.
Thank you.
Thank you, comadre. We have Andrea Curry here. Question for the doctor. Why are our cases going up if Santa Clara County is so highly vaccinated? Is it still not high enough? And we froze, and I'm not sure if it's me.
The point of herd immunity, that's one point. That's what the question in terms of still high enough. It gets that question. And then the one about being highly vaccinated. Yeah, as I was saying, we're very proud as a county, being at the 80s for being a large county. We're the tops in the nation, but there are pockets. There are pockets of communities that haven't gotten to that 70, 80% level even now. So and that's what I mentioned when Karina did the slides there in the Latinx. Latino Hispanic community, you're in the 60s, so that needs to get improved. We need to get better. And then we're talking about a population that's 12 and above, and we're missing the 12 and below. So the way I would think about it is, we know there's a virus, SARS, COVID, and the question is, how do we stop it? You get the vaccine so that virus cannot get into that individual. So who is susceptible? That 40%, and I'm talking specifically about the Hispanic, Latinx, Latin community, because they're at 60. So you have 40% that are unvaccinated. Number one. Number two, you're also at the 12 and below who are also unvaccinated, so they're also susceptible. Again, this virus could get into anyone that's not vaccinated. So that would be my explanation of why you're seeing cases go up, not only here but also just across the United States. So that's why it's going back to hitting the point real hard in terms of if you're not vaccinated and you're able to get vaccinated, I do understand that some individuals, for medical reasons, they may not qualify, or because of an allergy or something, that they won't be able to qualify for the actual vaccine. But for those that are able to get one, please do so as soon as possible. And it's because of this, to prevent the spread of the infection. And then it also gets to the point of the variants. So if you're vaccinated, the virus will not get into that person, and there's no way it could get different. It cannot change because it's not in the person. So we need to, again, going back, to get vaccinated.
Great. Thank you so much, Doctor. And we have Tino Garcia Barragan here, and he is actually, he talks about another, I think, virus he mentions. And thank you, Tino, for joining us. We are focusing today on COVID-19 and Delta variant and anything in relation to. Good points. Thank you for your messages here. And thank you for joining us and for providing your points of view. Welcome. We have Guadalupe Moctezuma here. Guadalupe Moctezuma, thank you for the information. Thank you, Guadalupe. We have Suresha Samarasingh. Is there a chance Santa Clara County will move to the orange tier again? Good question, Suresha. And so
I mean,
what I
if
would answer to that is that's what we're trying to prevent.
yeah,
And so, which is
right,
why we're here, which is why
right,
the doctor's providing the information he's trying to
mm,
provide. We're at the recommendation level of wearing the masks, even though we're vaccinated indoors
right,
when we go to different businesses. And so that's what we're trying to prevent. So I would love to answer,
yeah,
definite yes or no. And at this point, my answer will be is that we're trying to prevent from moving into any of the tiers. We've gone away from the tiers. We're moving forward, and we're hoping that our entire county can get vaccinated. That's our wish, right? That we had 100%. It probably will not be, but that our entire community, right, not just certain populations in our community, um, are in the 90s, even in the 80s. If we got to the 85, I think we can for sure stay away from being in the orange tier. And that's just my 2 cents. Doctor, do you have anything to add to
yeah.
that?
And sorry, I think I kind of did want to answer it at the previous question, talking about herd immunity. When all this started, the pandemic, if you look at our health experts, I remember Dr. Fauci talking about a 70% back in March, April of 2020, and then in the last few months it moved to like a 75, and now is it the 80s, 85s, even 90%. So I think it's a week by day, week by week, getting down to the point. But for sure now we know it's got to be above 70, and we're and this county's above 80, so we need to get that number up. I think going back to, and it's very important, the slide you mentioned with the pockets of certain communities not being vaccinated. So any individual who's not vaccinated, get vaccinated, so that we get to that the highest number possible.
Thank you, Doctor. We have Paula Deneri here, who says someone who had COVID twice has not gotten the vaccine yet because she said she has antibodies and her doctor told her she couldn't get the shot for 6 months. Is that true? So all the millions that have had COVID, could that be a reason why we aren't seeing a larger percentage of the population being vaccinated? I'll leave that to you, Doctor.
Yeah, it's a very very good question. Thank you so much. So break down the question. Some who had COVID twice. So the recommendations are that if you were infected with COVID and did not get IV antibody treatment for your COVID infection, then technically, if you're out 10 days and out of quarantine and you're feeling better, then after that infection, you do qualify for any of the three vaccines. It's only if you got antibody treatment through the IV, and usually, you'll know because you'll either go to the ER or go to a special clinic. And if you got those antibodies, then you would need to wait 90 days. And then the question would be, I mean, I know you mentioned the individual being, being infected with COVID twice. Unusual, but it's possible. And now the question would be, if that has happened, can that person be protected for forever? And the study science that's coming out right now is saying that even in those individuals that have been infected once with the original variant, or they may not be protected for the next variant, that actually the vaccines do a better job of protecting you from these variants, because they've been studied. And so I would say in that situation, even someone who has been infected once, twice, they will still qualify if they're out 10 days after the quarantine. And then you had the question of, so all the millions that have had COVID, could that be a reason we aren't seeing a larger percent of the population being vaccinated? And I think there's some truth to that, in terms of some individual might have that thought that, okay, I was infected once, so I'm protected from the next variant, so I don't need to be vaccinated. And that's the science for now. It's saying that yes, there is some protection from the innate first infection, but it's actually better to get vaccinated with one of the 3 vaccines. And there was actually a week ago, I was reading my scientific journals, and antibodies levels were done in individuals that were infected and then got the vaccine 10 days later. And then actually they finished off their 2 series vaccine, being the Moderna or Pfizer. And then the scientists went ahead and did antibody levels. And those people that got the vaccine, and again, these people were infected in the past, they actually had a higher level of antibody protection. So they actually, these scientists were saying that, wow, actually that the innate infection, the natural infection, got you some antibodies, and then we came in with this vaccine, and you're actually at a super level. So there is still, if you look at science and the studies, there's still going to be that recommendation that even if there was infection in the past, that vaccines still will be of a benefit for your future protection against any kind of COVID, SARS virus in the future. And again, going back to the, well, if there are variants, are levels going to go down, and we're going to need a booster? And that's still the question that the state, local, federal, and the scientists are going to come up with. Excellent question.
Thank you, Doctor. And we have our next question here from Victoria Scullen. Will the data dashboard return to showing daily counts instead of the 7-day rolling average? It seems misleading to have an average from the previous week as the numbers increase rapidly. Thank you, Victoria, for your question. Very good question. And if you remember, less than a month ago, we were doing, a lot better. Our numbers were going down, staying down. And so we were all, gearing towards working our way out of this emergency mode, if that makes sense. And so I know that was a part of the changes in the dashboard. Things shifted quickly. Is that going to change? I'm not sure. I'm not in that department, but I think we were, going into the shift of moving out of emergency mode, and now we're kind of at we're not ready yet. Hopefully we all listen in regards to wearing our masks, getting vaccinated, and all that good stuff, so that we can stay on this path that we were on. Moving out of the emergency mode and back to our quote unquote normal, whatever that means, right? I mean, not necessarily normal, but I guess better is how I'm going to put it, moving back to better after everything we learned through this pandemic. So good question, Victoria. I will definitely, bring it back to the team. We'll have some conversations, and in our next community forum, hopefully have an update on that. And maybe you'll see a change in the dashboard to doing it on a daily basis before that. So thank you for your question. Paul Horseshoe Soto, thank you for that information and for your work. Thank you, Paul, and thank you for
Thank
joining us.
you.
Mark Weber, are child care centers going to open to full capacity? Good question. Doctor, I don't know if you have that answer specifically. I have what I think, but.
Right. No, and I go back. I think the themes that I want to make is, or we want to all make, is that we've made tremendous progress with the vaccination percentages, and we need to do better, get better, and hopefully, this is what's gonna. And we've said it, that this is gonna, help us get to normalcy and the full capacity question that's being asked.
Thank you, Doctor. And then we have Joy Williams here. Are cases going up for kids under 12 due to the Delta?
I do not have that information for our. I mean, maybe you'll know, Karina, but I do know from like state, national, the dominant variant is the Delta, and that's what's affecting who's sick right now, and that would include, And then let me step back, and we're seeing a younger population. We still don't know why. I mean, one reason, of course, being that the younger population not being vaccinated, and I'm talking about adolescents or even young adults that are, which we're seeing more cases of Delta and that, and also going to be it's going to be also the 12 and below because they're not vaccinated.
Thank you. And good question, Joy. I don't have the specific numbers, but to put up today, but I will go back to the team, request those, and in our next community forum, hopefully have a breakdown of what the numbers look like for children under the age of 12. Good question. And then we have Antoine. The dashboard also has the case counts by day listed in the visual. Hover over a bar on the given day, and the pop-up will give you a count. There you go. So you can then there see the case counts by day if you hover over the bar. Thank you, Antoine, for tuning in and answering that question. We have Andrea Curry. Thank you. Again, thank you. Teresa Caceres Betancourt, worried about children. They cannot be vaccinated. Are we seeing the Delta variant in our little ones? So kind of similar to the other one as to what the numbers look like for children. So yes, we don't have the specific numbers. I'll go back and ask and request data on the specific, on children specific. And then Doctor, I don't know if you want to add anything else to that.
No, again, I think it's been answered in terms of, we know the Delta variant is what we're seeing. We know from studies that it's more contagious, and it could also lead to more severe disease, hospitalization, death. Stepping back, we know that in terms of a younger population, children have, from the initial studies, and it's a day by day, week by week, there's less severity, but children could become severely sick, and death too as well with this infection. And there is maybe some information or data too that it could be more severe as well in children. So going back makes it even more important for us, those that are available, to get vaccinated. And then talking specifically for the vaccination of the 12-year-old and below, I think the studies are going to be coming out and all that, to get the vaccine approved to them, as soon as possible. I think one of the targets is to potentially have a vaccine ready for them in early fall before school starts.
Thank you. And then we have Tino again. Tino mentions everything I wrote was directly related to COVID-19. Shame on you for ignoring my question. Absolutely not here to ignore your question. Thank you so much for being here. We want to make sure that everybody tunes in and has their questions answered. In regards to I didn't hear any questions in regards specifically to COVID-19, Delta, or any of the recommendations that I reported on. And if I did miss it, please restate your question. In regards to the VAERS, it is a passive reporting system, meaning it relies on individuals to send in reports of their experiences to CDC and FDA. And so the experiences piece, very key. We want to make sure that what we report is not just based on experiences, although everybody's experiences are valuable and definitely, should be taken into account. But yeah, I mean, I don't want to go more into detail other than know that, I'm not here to ignore anyone. Please make sure you put your questions down, especially in relation to what we're talking about today. And if there's anything, Tino, that you have a question for in regards to COVID-19 specific to the Delta variant today, any of the recommendations that we made a report on, any of the numbers that we made a report on, please make sure to put your question down. But we welcome everybody here and not here to ignore anybody. Thank you again for tuning in. We have Victoria Skolin. Antoine, I've been using the raw data. My concern is a rolling average may make it look less bad to people who don't look at the daily data. So thank you, Victoria, for your feedback. And thank you also, Antoine, for being here and helping respond to some of those questions. We have Yi Chen. How long does people protect from COVID-19 after 2 shots of Moderna? 9 months or 1 year or longer after 3rd shot?
It's a very good question. Thank you so much. And it goes back to the question, are we going to need a booster 6 months now? 6 months from the original vaccine. So I'm basing this only because in January, that's when we started, giving the vaccines here in the US. So now we're like June, July. So the question is, are the antibody levels that were built because of the vaccination, are they high enough now or not? And that's where the scientists and the authorities, and that's why I mentioned CDC, FDA, and NIH, they're, I think, day by day, week by week, we're looking at this data. We're looking at the Delta variant and, who's been affected, vaccinated, unvaccinated. And then from there, taking all that information and saying, okay, we have evidence to say that at this month, X months, 8th, 9th month, 7th month, we'll need a booster. And that's when, that will come in. But until that's, we're, keeping our ears open with, of course, or the county and also state and national organizations and leaders.
Thank you. And then he also asks, COVID will become flu because short chain of RNA mutates all the time. Is it true?
I mean, one thing I tell, all people that I see, COVID is it's a new virus, new in terms of affecting human beings. Yes, there's been same family, similar molecular level genetic viruses to it, but at the same time, and that's why I go to the day by day, month by month. Is this mRNA gonna act like other viruses? Is it different? It's pretty much, waiting for the scientists to look at the evidence, look at the studies, being in the laboratory, being population studies, and figuring out the virus is behaving like we expect, or no, the virus is acting differently, and we need to do something else in terms of the vaccinations. At this point, I want to give you the confidence that what we're seeing is that, and then going back to the data that I presented, Maryland is seeing, you know, deaths more in the unvaccinated. So what we got now, what you got, you know, in January, February, your vaccine is working right now, regardless of the RNA genetic makeup and stuff. So I really don't bog down on, I wouldn't bog down on that so much. It'll be more of the what's happening, more of a population base in terms of, are we seeing a decrease in hospitalization, sickness, and those that have been vaccinated? Because if that's the case, then that goes to show proof that these vaccines are, you know, 95% effective, like the studies were done initially back last year, early in the pandemic.
Mm-hmm. Thank you. And we have Antoine, who came back and said, I see data from the most recent 7 days is preliminary. So with the 7-day average, with a 7-day lag, gives a more accurate idea of cases. The sewage monitoring dashboards are helpful as well to get a sense of where things are headed. Thank you, Antoine. And we have Book Lala. Suresha, the tires are done and over with. We're never going back, right? We're hoping. Let's make sure we get our vaccines and continue to be safe out there. Christina saying no masks. Yeah, I'm looking forward to those days too. Book, so it's just vaccinated people that are getting the Delta. So it's just vaccinated people that are getting the Delta, doctor?
No. So let me step back. You know, like I've mentioned, you know, the initial presentation is that, you know, and looking at the data, and I give you the Maryland state data, it was 132 people, you know, that passed in June with COVID related, and they were all unvaccinated. So it's the unvaccinated that are getting, you know, severe disease and death. Yes, there's breakthrough cases. I mean, all vaccines are not 100%, and there are individuals who are fully vaccinated and are going to, you know, get infected with SARS-2 COVID, and the dominant strain, or I mean the dominant variant being right now Delta. So that is going to happen, but the studies have looked at it, and the percent of severe disease, hospitalization, death is like 0.003%. So although it's possible that there could be a breakthrough case after being fully vaccinated, it is very low. And when you ultimately, you know, compare severe COVID, meaning hospitalization, ICU, or death, 99 to 100% of those cases are going to be unvaccinated. And most likely now, Delta variant being the most common one across the United States and across the world, is going to be that. So I just want to make sure that, you know, the questions, there's, you know, the vaccinated, it's more of the so it's just the unvaccinated people that are getting the Delta. I would phrase it that way.
Thank you. And I'm going to focus on the questions directly to us. It looks like there's some questions back and forth to our audience, which is great. Continue to have a conversation. That's why it's a public site here. So Christina mentions, if you don't have the data, don't make recommendations or mandates. So Christina, maybe you misunderstood. We absolutely must have the data somewhere in our county. I just don't have it today to report out. So yes, know that I'm going to look into that so that our team in Santa Clara County who focuses on data can give me that information so that I can then report the numbers to you. And know that anybody doing any mandates or recommendation absolutely looks at all of our numbers before doing that. So I just want to assure you of that. I'm the little person in the Emergency Operations Center. Dr. Sarah Cody, when she comes out and gives those recommendations or mandates, know that she has looked at data and understands the data at that time And then know that the data changes day to day. So I will make sure that I get the most updated data, and at the next time, I will make sure that we report on our children. I think is the main data right now that is being requested. I'm with you. I have a child of my own, and several other children that I support in our community. All right, we have Paige. Let's see. As a person who was raised in an anti-vaccination home, I get your frustration. Okay, so back and forth. Thank you so much for your. I'm just looking for the question specifically, wanting to take advantage of our time here with our doctor. Um, let's see. Thank you for taking our questions. I have another one regarding schools. Do you know if masks will be required when they return in the fall? Good question, Paige. Again, I think I mentioned a little while ago, for the most part, my understanding is yes. However, make sure you contact your school district, whichever one it is that you're asking about. Um, my guess is yes. And again, if obviously the mandate, whether it's federally or state, we all get to follow it, but it might fall on each district specifically. So, for example, I know Alum Rock School District will continue to wear face masks. But at this point, in regards to the fall, hoping that we're vaccinated, hoping that we're in a much better place. You never know, we might not. So at this point, I would just say contact your district and stay in connection with your school district to answer that question. All right, and we have Tino back. Awesome. Why won't you question the county health officer for not talking about VAERS reporting system as it relates to COVID-19 deaths and severe injuries? Question mark. So um, it's not that I won't. I can definitely forward your question to our health officer. I have no problem doing that. So I will make sure to forward that question over to our health officer. Thank you, Tino. Um, and then we have Alejandra Quiroz. Are there any newer, stronger variants than Delta? And is Santa Clara County planning to reinstate the mask and social distance mandates during the fall winter? I guess we'll break that up in two, Doctor. Are there any stronger variants than the Delta? Let's start that there.
So the way, again, going back to talking a few minutes ago, just how pandemic started. You have your original strain, and then original variant, and then from there, infection happens, and that original variant becomes a Delta variant. And you're right. There's a few. There's the Alpha variant. There's a Gamma. So at this point, the one that we're worried about more, because it's the one that's more in circulation, is the Delta. And what we do know, it is more contagious. But again, if you're vaccinated, it does a very good job of protecting you. And so it's more contagious, and it could lead to possibly more severe disease, meaning hospitalization and death. I'm more familiar with that. Alpha and Gamma, I believe there was some evidence as well as more severe disease and more contagious. But the one that, again, going back to focusing, because it's more common in the population now, is the Delta.
Thank you, Doctor. In regards to reinstating the mask and social distance, I think like we've mentioned earlier, that's what we're trying to prevent, any reinstation of any mandates. And so therefore, let's get vaccinated, continue to wear our masks, even though we're vaccinated. So at this point, kind of similar to the question about school and wearing face masks, let's ensure that, we get vaccinated and we wear face masks so that we don't have to get back into reinstating any mandates. Thank you. And then I do see some back and forth here. I'm going to focus on, let's see. I'm going to go to Paula. Just because she puts out some information, I just want to confirm, Doctor, that she has this correct. She says, it is the unvaccinated that are getting the Delta and account for 98% of those dying from it. Vaccinated people can get it, but don't get very sick or go to the hospital. Does she have that correct?
Yeah, I mean, and that's what I think. I'm going back to the, I want to give you solid data. Going back
Yeah.
to Maryland, 139 of their deaths, COVID, were unvaccinated individuals. So I mean, that goes to show you. And
Yeah.
if you do, you're vaccinated and you end up becoming infected, which is possible. Again, very unlikely, 0.003%. If you do get sick, the possibility of being severe disease, hospitalization, or death is also very, very low.
Mm-hmm. Thank you. And let's see, question. We have Andrea Curry here, who mentions one more question. Um, is it a good idea for people to get antibodies checked after they get a vaccine? Is that necessary or helpful?
Andrea, very good question. Thank you for that. It's a question that I think we asked as we started vaccinating individuals, not only in the county but across the state and nationally. And then if that question were asked to Dr. Fauci, he would say no. There's no need to check antibody levels after a month after you got your whole series on Moderna and Pfizer. The science says is that there's no need for it. Um, and also, one thing would be like, if we were to go that route, it would be, millions of individuals. I think we would do it if really science says that when we needed to, but the studies said that as long as you finish your one shot J&J, Moderna, Pfizer, and then you wait your 15 days, 30 days to mount that immune response, that we don't know. We as doctors, we don't need to go and say, okay, you got your Pfizer a month ago. I need to go check your antibodies just to ensure that you're protected. That was never recommended. I will say that some doctors or specialists might want to check in certain individuals. For example, those that are immunocompromised. For example, they have a kidney transplant and they're on medications that lower their immune system, so they may have a lower response to the vaccine because of that medication, of that chemotherapy or drug. So I do see that some specialists might, for a case by case basis, say it'll be a good idea to check you, and then from there decide if another booster is needed. That could happen because we've seen it in our vaccination sites where certain doctors will do that, and then they come to us asking for a third dose. And that's why Karina initially mentioned that if that happens, you probably need to go back to that doctor and or your healthcare provider and talk to them, because at this moment, I don't see any guideline from the CDC, FDA, NIH that says we need to check antibodies on such and such individual, or a whole mass antibody blood test. But it's an excellent question, and day by day, week by week, we'll know what we need to do.
Absolutely. Thank you so much, Doctor. It is 3:30. Thank you for that. One more question, Andrea. I do see Tino Garcia coming back. I thought I had answered it, but apparently I didn't. So Tino, I'm happy to connect with you offline. I want to make sure that we're having that transparent conversation with our county. Any questions, comments, concerns? Dr. Gerardo Solorio Cortez, thank you so much for joining us again.
Thank you.
Know that we have him every other community forum. So once a month, he'll be here answering questions. And we are very blessed to have somebody who is on the front lines at the vaccination sites, learning about these vaccines and having that information. For more information, as you see on our screen here, go to sccfreevax.org or call 408-970-211 or 2999 or 211 to schedule an appointment to continue to ask any questions. Looking forward to continuing to connect, and know that we have a 4:00 in Spanish on our Facebook County Spanish channel. So if you have any family members, if you have any other questions and you speak Spanish, feel free to jump on that one. We'll be happy to serve you and the rest of the community in Spanish, our Spanish-speaking community. Otherwise, we'll see you at our next community forum. Thank you again for joining us, and have a great 2 weeks. Bye.
Bye-bye.